Hidden Stories of York Region is a Made in York Region podcast series aimed at disrupting the dominant narratives by sharing stories about lived realities, community issues, and innovative solutions across the region. Each episode features guest speakers living and/or working in York Region. Our conversations tackle challenging community issues and identify solutions and actions for change. My name is Risha Mandelkorn, and I will be your host for episode 3 of Hidden Stories of York Region. Affordable and accessible housing is a basic human right and is essential to the infrastructure and health of our communities. The needs and challenges are so great that we are devoting all 4 episodes of Season 3 to the housing challenges in York Region. Hidden Stories of York Region acknowledges that our work takes place on the traditional lands of the Anishinaabe, Haudenosaunee, and Huron-Wendat. We acknowledge that we work and play on the ancestral lands of all Indigenous peoples who have left their knowledge before us. We acknowledge those who walk the lands now and future generations to come. Hidden Stories is committed to sharing the truths, realities, and knowledge of Indigenous communities in York Region. COVID-19 has disproportionately affected populations who are already precariously housed or homeless. For young people, especially those in the 2SLGBTQ+ communities, the need to prioritize stable housing with a safe and affirming support system is essential. Until recently, most of the research has been focused on urban communities, but homelessness is not just a big city problem. It is a problem that lives in York Region. With me today are Jesse Vacarciuc, a youth worker at 360 Kids, and Dr. Alex Abramovich, scientist at the Institute for Mental Health Policy Research. Jesse wears many hats. They are an artist and musician, a child and youth worker, a person with lived experience in homelessness, a peer mentor, but most important, a young person dedicated to making change. After leading and co-leading many activist-based events, they were awarded youth recognition in the framework of the Public Heroes Program. They have developed a 2SLGBTQ+ centered program at 360 Kids to offer education and support to youth and professionals in the community. Welcome, Jesse.
Thank you. Thank you.
Dr. Alex Abramovich is a scientist at the Institute for Mental Health Policy Research at the Center for Addiction and Mental Health and an assistant professor at the Dalla Lana School of Public Health and Department of Psychiatry, University of Toronto. He is an award-winning, internationally recognized leader in the area of 2SLGBTQ+ health and homelessness, whose research has led to groundbreaking practice and policy reform, including the launch of Canada's first dedicated transitional housing program for 2SLGBTQ+ youth. Dr. Abramovich has worked closely with all levels of government and is committed to research that successfully and ethically engages the community and situates 2SLGBTQ+ young people experiencing homelessness as knowledge makers. Welcome, Dr. Abramovich.
Thank you so much for having me.
So, Jesse, can I ask you to begin the conversation by sharing a bit of your own lived experience?
Of course. So I've had a lived experience, I think, all my life with many difficulties that we see amongst the youth experiencing homelessness today. Things like unstable housing, abusive families, addiction, homelessness. And really, I actually started living on the streets when I was about 18 years old. And so it was quite something to navigate, especially considering the many different traumas that you can experience on the streets in itself. And it was a huge battle, really, to figure out, how to situate myself, how to be a functioning person in society, how to navigate mental health, how to navigate employment, how to navigate housing. And really, I've been struggling with addiction probably since I was 12. So that's almost 10 years of struggling with addiction. And yeah, it's a lot of lived experience there that really makes me more knowledgeable in understanding the youth that I support today, which is important. So, so important.
Thank you, Jessie. Thank you for your honesty and for sharing. Alex, you led a seminal research study in York Region interviewing homeless youth. What were some of your key findings regarding the experiences and challenges of youth at risk of or experiencing homelessness?
Yeah, thank you. I should really actually start off by saying that, the reason that I actually led that study and the reason that I do this work, and that I have been doing this work for so long, is because 2S LGBTQ young people are greatly overrepresented among youth experiencing homelessness across Canada. And actually, truly make up, close to 40% of the homeless youth population across the country. So they're really disproportionately represented. And even though we've known this for a long time, there is minimal research, investigation that has really looked into into these issues. And so it has been very important for me, over the course of my career to really truly focus on this issue and to bring some understanding and hopefully some solutions to this ongoing problem. And so, yeah, you asked about the York Region study. And so, as you mentioned, this is an issue that has really been sort of understood as a big city problem for so long. And that's really not the case. We know that 2S LGBTQ youth experience homelessness across the country in all communities, because queer and trans folks, we exist everywhere across the country, not just in big cities. And I think that's really important for people to understand that, the overrepresentation of queer and trans youth experiencing homelessness is also a problem in a place like York Region. And so that's sort of what that was the focus of this study, was to really understand what are those experiences like for queer and trans youth in a place like York Region. And some of the findings were really not very surprising at all. I would say that some of the findings really aligned with previous research that I've conducted and previous research that has been conducted in the area. So for example, we found overrepresentation of mental health issues. So really sort of a lot of, I would say the majority, almost all of the young people who participated in the study reported experiencing significant rates of depression, anxiety, and suicidality, as well as increased rates of alcohol and substance use. And this is an issue, I would say, that really is sort of across the board for so many young people, regardless of how they identify, experiencing homelessness, especially for 2S LGBTQ youth who often don't have safe places to turn to for support. So, with the added stigma and discrimination, not having places to turn to for support, it's no wonder, that would result in increased rates of mental health difficulties. So, another issue that we found was a lot of the young people were experiencing hidden homelessness. So we had difficulty recruiting youth to participate in the study because they weren't accessing many of the sort of mainstream services that exist across the region. And so many of the youth were either sleeping in public spaces or they were couch surfing. So they were more difficult for us to access, to find a way to speak with these youth. So we relied very heavily on the youth that did come forward and that we were able to recruit to sort of spread the word, through their network. And I would say, another major difficulty or another major finding was the difficulty around access to support services, which is really an ongoing problem. A lot of the youth reported great difficulty accessing services in general. And when I say services, I mean housing services, shelter services, healthcare. All of these types of institutional settings tend to be very complicated, I would say, to navigate, especially for trans and non-binary youth, because, a lot of these services really don't necessarily understand, sort of the struggles and the challenges that a trans or a non-binary young person might face. And so, just quickly, just an example might be that, some of these services, they only have male and female washrooms. And so, if you can't even access a bathroom in a service, in a support service, then that's really no place for you to be, right? The moment you walk through the door, you have to fill out a survey or a questionnaire that forces you to categorize yourself in a way that doesn't align with your identity. So for example, you might have to check off a male or female box to identify yourself. But what if you're non-binary, or what if you're trans and you don't fit into either of those boxes? And then, as I mentioned, not being able to access the bathroom. So these are all sort of ongoing issues that youth had reported throughout that study.
So would you both weigh in on the effect the pandemic has had on an already challenged population? We'll go to Jesse first and then Alex.
Well, one thing with the pandemic, I think, is it made services much more inaccessible, and for youth who were at risk of homelessness had to spend much more time in unsafe living environments, possibly abusive homes, which can easily lead to crises, mental health crises. So this is why we see the increased anxiety, suicidality, depression rates. And then when it comes to the population who is actually living on the streets, it became very hard to access services as well. And more specifically, I always think back on anytime that we didn't have anywhere to sleep, anytime that we didn't have anywhere to stay, we would sort of go at the 24-hour food establishments, right? McDonald's, Tim Hortons, spend the night there. And that was always a backup plan. And when the pandemic hit, that wasn't available anymore. And so a lot of youth had to spend their nights living on the streets, and especially in winter, especially in the cold. And even then, when one thing that I saw when we were outreaching during the winter to the youth on the streets is that a lot of the shelters were at full capacity. And no matter the shelter that you called, there was never any space. And even today, even nowadays, the shelters that sort of arised out of the pandemic, hotels that were transformed into emergency shelters, all of a sudden closed down, became unavailable. A lot of the shelters actually in the York region right now are currently closing down. And so it sort of makes you wonder, what are people living on the streets supposed to do following that?
Thank you. Alex, over to you on this one.
Yeah, I actually led a study that throughout the pandemic that looked at the impacts of the COVID pandemic on 2SLGBTQ youth at risk of and experiencing homelessness in the GTA and surrounding areas. And this was an ongoing study throughout the pandemic where we sort of followed youth through different time points, and we assessed a variety of variables, including their mental health, their living situation, employment, a whole bunch of different variables. And we found that the pandemic really did impact all of the young people in a variety of ways. And so some of the most significant ways that youth were impacted, I would say, is that we saw a stark increase in the unemployment rates that youth had reported. And I know that this is something, that really has been reported by many people, not just young people and not just 2S LGBTQ individuals, but we really did find that there was quite an increase in sort of the unemployment rates. And then we found that the majority of youth who participated in the study reported that they had significant changes to their housing situation when the pandemic hit, and then throughout the pandemic. And this really included decreased housing options. So a lot of youth who were maybe they were couch surfing prior to the pandemic. Well, then when the pandemic hit, they were no longer able to do that. Maybe they were staying at a friend's house and they were told, sorry, you can't stay here. You need to go back to, where you were prior to the pandemic or prior to coming here. And so in that case, there were definitely a cohort of youth who were forced back into abusive households. And, that was quite a dangerous situation for many. But then we also found that there were a lot of youth who reported living in public spaces during the pandemic. So for example, I think it was 12% of youth were living in a public space prior to the pandemic. And then when the pandemic hit, 32% of youth were living in a public space. And so, for example, when I say public space, I mean, I'm talking about youth who told us stories about pitching a tent in a cemetery. And they pitched a tent in a cemetery and slept in a cemetery because of the lack of safe and inclusive housing options that are available. And I think that, to me, actually was really the most shocking finding, was hearing youth really speak about the lack of safe housing, and the fact that that we had young people talk about sleeping in a cemetery, and that was their safest option. I think when we hear that, like, that really speaks to a very, very big problem. If that is the safest option for a young person, I think that is extremely problematic. And yeah, and then I think I spoke about just sort of the unsupportive, homophobic, transphobic settings where youth were forced back into. In many cases these were family houses, and feeling like there was really little ability for them to escape these situations, because, as Jesse mentioned, that so many places were shut down. So many of the supports that youth relied on prior to the pandemic were no longer available to them. And of course, this is such a cycle, because then that leads to the, once again, elevated rates in mental health challenges and difficulties. And so this is truly an ongoing issue. I know that, things are certainly improving with the pandemic at this point in time, but I think for a lot of the young people, they are still struggling.
And, I think it's important to remember that we're not just talking about young people in general. We're talking about every single individual person who is a young person. These are individual stories that make up the whole. It's not an abstract number. It's lives that we're talking about. Looking at the current landscape, Jesse, how can the community, and not just service providers, provide better support for gender diverse youth?
I think one really important thing when it comes to gender diverse youth is having that education towards non-binary youth, towards gender diverse youth. It's one of the things that you see most often. I think even, what I experienced and what I see happening within the shelter systems and the community service systems is that it's a constant, having to explain yourself, having to explain your identity, having to constantly correct people, having to constantly, reassure people, oh, it's okay, if you misgendered me, and whatnot. And it's so much effort, so much mental effort to have to constantly explain it, constantly have to correct the individuals around you. And the best thing I think that we can do is educate ourselves about gender diversity, educate ourselves on how we can properly refer to gender diverse youth or gender diverse individuals, and then really just communicating with any gender diverse person that you meet, and just being open to whatever recommendations they have for you, because at the end of the day, they're the ones who are experiencing their own life, not you, right?
So, Alex, what are some of the recommendations stemming from your research that you would make to policymakers, service providers, and funders, both private and government?
Mm-hmm. Yeah, so I would say that, there are definitely a variety of solutions to a lot of the issues that we're talking about today. And some of the solutions are much easier to implement and can be implemented rather quickly. And then, of course, there are others that, certainly take much more time and more resources, often more funding, and certainly, would take a little bit longer. But something that I talk about a lot actually in my work, and something that I have talked about a lot over the years, is the need for a standardized model of care in the services that we do deliver. And this really speaks to what Jesse was talking about. And this is, when I talk about like a standardized model of care, this would be a model of care that really creating accepting, safe, and affirming environments and all of the services that are meant to support youth. These are services that were built to support youth, to provide housing, to provide healthcare supports. And so there needs to be a more standardized model so that young people can know what to expect when they access services, rather than always having to worry about what's going to happen when they access the service. Can they speak openly? Can they bring their full authentic self to services? And so, for example, this type of a model of care would involve, I spoke about some of the forms that youth are asked to fill out when they access services. And so rather than having a whole variety of forms where some services might have more inclusive forms, they might ask more inclusive questions. Well, working towards a model where everyone is including the same type of forms. So we know that the questions are going to be inclusive so that young people know that they're going to see their identity reflected in the response options of the questions that are asked. I think it's very, very important for people to see themselves reflected in the services that they access. And that is from everything from the forms that are offered, from the people who work there, from the posters that are up on the walls to the programs that are delivered in the service. And there is, quite a bit, more work that needs to be done to move towards this direction. I think there certainly has been some really great work that has been done, and we have seen some really wonderful and supportive programs open across the country, population-based services specifically for 2S LGBTQ youth. And I think that's a really great start, but unfortunately, we're not there yet. We still have a lot more work to be done, given the fact that many non-binary and trans youth will access a service and not be able to access a bathroom. That if we're at that point where we're talking about young people sleeping in a cemetery because that's their safest option and not being able to access a bathroom that aligns with their identity, that tells us that there is so much work that has still to be done. And so in terms of recommendations, I really advocate for this standardized model of care, for putting more resources into mental health care, population-based mental health care, population-based housing programs specifically for 2S LGBTQ youth. We know that these types of programs, they work very well. These are successful programs that save lives. And I think I would probably end there.
I'd like to close out with some final comments from each of you on the importance of making supportive housing for 2S LGBTQ plus youth a priority for York Region. Jessie.
Yeah, it's 100% a priority, right? Because when we're seeing, as Dr. Abramovich mentioned, as Alex mentioned, youth living in cemeteries, youth sleeping in cemeteries, youth not being able to access bathrooms, and I've lived it too. I've lived it in many different spaces. I've seen it. I see youth today that I work with experiencing it as well. I've had to constantly see youth, leaving their shelter setting to either move couch surfing, go on the street, move into a different housing arrangement just because they felt unsafe where they were at, looking at all of the different things that youth report about the housing arrangements that they have and the experiences they're reporting, seeing all the homophobia, all the transphobia happening and not having appropriate reactions to it as well. Is one thing that it'll really go towards worsening your mental health. And we already know that the suicide rates and the depression rates amongst 2S LGBTQ youth and gender diverse youth are incredibly high. And so the last thing we want to do is worsen the situation. And it's time to actually start caring about, as you said, the individual stories of the people who are experiencing these things and the individual needs of every single person who's living on the streets, who's accessing the services, who might be part of the 2S LGBTQ community.
Thank you, Jessie. Alex, can you give us some closing comments?
Absolutely. I would say that everybody has a right to feel safe in their home. Everybody has a right to a safe home. Nobody should be afraid to be at home, and nobody should be afraid to leave their house. And unfortunately, that is, not the situation that we're currently in. And that's why it is so important that we prioritize the needs of 2S LGBTQ youth who are experiencing homelessness. They certainly have a right to feel safe and to access safe and affirming services. We have a social support system in place. And this system is meant to support all young people, regardless of their gender identity, regardless of their sexual orientation. And that should be a priority, that it certainly should be a priority. And I think that oftentimes a lot of what we're talking about, people think that it's complicated. People are afraid to talk about these issues. I think there's a lot of fear. I think for some people that, they might be afraid that they might say the wrong thing. They're afraid to use the wrong terms, or they're not sure what terms to use. But I would really say that, a lot of what we're talking about, it's actually not complicated. A lot of this is really simple. It really boils down to basic human respect. It's about respecting people. It's about respecting a person's identity. If somebody tells you, I'm Alex, I go by he and him pronouns, well, that's not up for any sort of argument. That is to be respected. I think it's, safe to say that all of us want to be called by the name that we go by, the name that we introduce ourselves with. And that's actually how simple a lot of what we're talking about truly is. And I think I would end there just saying that truly everybody has a right to a safe place to call home.
Well, thank you both for sharing your personal and professional perspectives and for providing a framework for how we as community can do better. Today's episode of Hidden Stories of York Region featured Dr. Alex Abramovich and Jesse Vacarciuc. The simple answer to the problem of homelessness is to provide housing. But as we learned, housing for vulnerable 2SLGBTQ+ youth is complex. If we ignore finding solutions to youth homelessness, we will be adding to the chronically underserved adult homeless population. The key to creating change is multifold and will require the will and funding by government, nonprofits, and social service agencies. Season 3 of Hidden Stories of York Region was written and produced as a collaboration between the Social Planning Council of York Region and Aurora Public Library. Hidden Stories of York Region is available on Spotify, Apple Podcast, and on the social media platforms of the Social Planning Council of York Region and Aurora Public Library. If you enjoyed this episode, like us, share with others, and be part of the change.